Good morning, dear students. So today we are going to see some of the revision of anatomy pertaining to the endocrine module. Okay, so we will be seeing a few questions. Okay, which can come for your IFOM exams. Okay, so kindly go through this question and let me know what is the right answer. The following statements concerning the middle cranial fossa are correct, except which? The pituitary gland, that is the hypophysis cerebri, is related anterosuperiorly to the optic chiasma. The pituitary gland receives its blood supply from the middle meningeal arteries. The oculomotor nerve passes forwards in the lateral wall of the cavernous sinus. The internal carotid artery passes forward through the cavernous sinus. The abducens nerve passes forward through the cavernous sinus. So which all the following are correct except which one? Let's see each one by one. The pituitary gland is related anterosuperiorly to the optic chiasma. Yes, it is true. So you know that the pituitary gland will be located and above the pituitary gland. So there will be pituitary gland and above the pituitary gland will be the optic chiasma. Okay, so this one is right. The pituitary gland receives its blood supply from middle meningeal artery. No. So it receives its blood supply from internal carotid artery. Okay, there are superior hypophyseal artery and inferior hypophyseal arteries. Both are branches from the internal carotid artery. So this is the wrong one. The oculomotor, let's see the other ones as well. The oculomotor nerve passes forward in the lateral wall of the cavernous sinus. Yes, that's true. Because you know 3, 4, 5 and 6 cranial nerves, they pass through the cavernous sinus. That is the third. Here is the sixth. Okay, the abducens nerve, the sixth, as well as the internal carotid artery pass through the cavernous sinus along with the trigeminal nerve and the trochlear nerves. Okay, so this would be the wrong answer. Okay, so the next question. So this is a person who comes with difficulty in vision. Okay, so this is showing, this is the picture shows the visual field the person can see. So here you can see the lateral part of both the visual fields he is unable to see. So what is this condition called as? This condition is referred to as, yes, it's bitemporal hemianopia. Okay, bitemporal hemianopia. So usually this is because of the compression of the optic nerve, or say the optic chiasma. Okay, so you know that the optic chiasma is related superior to the pituitary gland, and when this optic chiasma is compressed, so this is where the visual fibers will cross the temporal fibers. Okay, so the fibers, they will be going, whereas the nasal fibers, they cross. Okay, so here there will be a compression. So we will be learning about this optic fibers and visual field in the special senses. Okay, so right now you remember that the optic chiasma compression will lead on to bitemporal, because the lateral ones are called as temporal. Okay, bitemporal hemi means half, anopia. Okay, loss of vision. Okay, unable to see. So bitemporal hemianopia usually indicates a lesion in the optic chiasma, most probably because of a pituitary tumor. In this case, okay, so as in this case, you will be able to see a swelling. Okay, so this is a bronchial cyst. Okay, and it needs to be removed. Okay, that's to show about the Cushing's syndrome. So usually this is because of a Cushing's syndrome. Okay, so there are two terminologies, Cushing's syndrome and Cushing's disease. In Cushing's disease, it's the primary problem lies in the pituitary gland, but if you don't know where is the primary problem, okay, you can refer to it as Cushing's syndrome. Okay, so once the in Cushing's syndrome, the problem could be anywhere. Okay, if the problem is in the pituitary, we refer to it as the Cushing's disease. Okay, now let's solve another MCQ. Which of the following nerves might be injured while tying the inferior thyroid artery during the operations on the thyroid gland? So the inferior thyroid artery. Okay, so the inferior thyroid artery, which nerve is passing close to the inferior thyroid artery? Sympathetic trunk? No. The internal laryngeal nerve? No. The descendants cervicalis? No. It's the recurrent laryngeal nerve. So the recurrent laryngeal nerve, so it passes close to the inferior thyroid artery, and that's why when the inferior thyroid artery is cut, okay, the recurrent laryngeal nerve can also be injured, leading on to hoarseness of voice. Okay, the next question. Which of the following statements concerning adrenal parenchymal cells is tissue? Is true? Okay, so it's true. Those of zona fasciculata produces androgens. Those of adrenal medulla produce epinephrine and norepinephrine. Those of zona glomerulosa produce glucocorticoids. Those of cortex contain numerous secretory granules. Those of zona reticularis produce mineralocorticoids. So which one of them is correct? So those of adrenal medulla produce epinephrine and norepinephrine. So this would be the right. Adrenal medulla usually produces epinephrine and norepinephrine. Okay. Now what are the other ones? The glomerulosa, zona glomerulosa, they produce mineralocorticoids. Okay, they produce mineralocorticoids. The fasciculata, they produce glucocorticoids, and the reticularis, they produce androgens. Okay, so it is all interchanged. Those of cortex contains numerous secretory granules. No, they do not contain much of secretory granules. So this would be the right answer. Prolactin is synthesized and secreted by which of the following cells? Prolactin is usually secreted by acidophils. Okay, it is usually secreted by acidophils. Okay, in the pars distalis. This also is one of the histological questions. Okay, you should also know like what are the secretions from the basophils, somatotrophs. Okay, so that also you need to know. ACTH, adrenocorticotropic hormone. It is produced by which one of the cells? Is it by chromophores? No. The neurosecretory cells? No. The basophils in the pars distalis? Yes. So it's produced by the basophils which are present in the pars distalis. Okay, neurons from the paraventricular? No, that's the posterior pituitary hormones. Basophils from the pars intermedia. So that's also not the right answer. Which of the following hormones lowers the blood calcium levels by inhibiting bone resorption? So is it calcitonin, epinephrine, parathormone, prolactin, T3? So you know that only two of these are very important in regulating the calcium metabolism, calcitonin and the parathormone. The calcitonin reduces the blood calcium levels, whereas the parathormone increases the blood calcium levels. Okay. So the answer would be calcitonin. Okay, the calcitonin. Okay, now the next case, a 51-year-old man underwent surgery for the removal of the carcinoma of his trachea. After surgery, he suffered excessive nervousness, muscle cramps, spasmodic skeletal muscle contractions. Lab test reveals low levels of blood calcium in his blood. Okay, so treatment with intravenous calcium led to recovery in a few weeks. Which of the following conditions is responsible? So you know that this is a person who went in for the cancer of his trachea. Okay, and after that, the surgery, the post-op, he suffered nervousness, muscle cramps, spasmodic skeletal muscle contraction. So this is the clue. Okay, so here the person is going in for contractions, tetany. Okay, he is going in for tetany. So usually this is because of the removal of the hypoparathyroids. Okay, the parathyroids. When the parathyroids are also removed along with the structure, other structures present in the neck. Okay, so this can lead on to hypoparathyroidism, leading on to symptoms that of leading on to symptoms like that of tetany. Okay, so this is the condition of parathyroidism. Which one of the following plays a role in regulating the body temperature by promoting heat production? So, which hormone helps in producing the heat productions? So, calcitonin which does regulate only the calcium but not much. Epinephrine, no, it has got fast action. Okay, but it directly doesn't cause increased heat production. Parathormone, okay, mostly concerned with calcium, nothing to do with that of the controlling the body temperature. Prolactin, okay, so that also doesn't help much in increasing the body weight, body temperature. Last one is triiodothyronine. Yes, so this would be the answer. You know that the thyroid hormones are the ones which help in increasing the basal metabolic rate. So this would be the answer, triiodothyronine. Okay, so that's it regarding the IFOM questions. If you have any doubts, you are welcome to email me, okay, or ask me. All right, wish you all the best.